All right, it's time for Yogi and the BeachMan. Hi, I'm Jim the Yogi.
And I'm Rick Beach the BeachMan.
We're two Michigan transplants now living in Southwest Florida.
In fact, we're cousins born in 1964, just a month apart.
I like to meditate.
And I like to play bass in a band.
I'm into chanting Om.
And I'm into throwing down some classic rock.
But together, we're on a mission
to promote people that are helping other people.
We want to make the world a better place.
One conversation at a time.
So sit back,
turn up the volume,
and get ready to laugh.
Because we like to have fun
while we spread the love.
Interviewing lovely people. Yes, we have fun.
Welcome back to Yogi and the BeachMan. Today we are with Shea Mino. Shea is a neurofunctional sports performance therapist. Shea, welcome to the show, and we appreciate you being here and taking time to sit down and talk with us today.
Thank you, Jim and Rick. Pleasure to be here, and thanks for having me.
Absolutely, yeah. So Shea, what is a neurofunctional sports performance therapist? Tell us about that.
Yeah, so I moved to Toronto in 2016 to pursue some more school. I'm a chiropractor by trade. In my last year, I did the acupuncture course at McMaster University in Hamilton, Ontario.
Okay.
And that's kind of what changed my entire career, to be honest with you. It kind of changed my entire perspective on injuries and pain management and whatnot. So yeah, continued all my actual training in that, and now that's kind of just what I focus on.
Excellent. So what made you leave being a chiropractor to get into sports performance?
Yeah, I'm still a chiropractor. I think when people like typically think of the term chiropractor, they think of, the back cracking and all the stuff you see online. The spectrum of practice is really broad now, which is amazing, but also has its, its cons as well. It's pretty confusing for the public. I always tell people that, like, whenever I even have athletes ask me, like, should I go get a massage or should I see a physio or chiro? Like, what's the difference? I always kind of tell people to, like, forget about the title, because to be honest, like, the title is a little bit, it's not significant, and just try to find somebody that is offering the type of treatment that you're seeking. Because there's a lot of, amazing physios out there, amazing, like, massage therapists even out there that specialize in the same thing. Right. So I always tell people to kind of just, because I'm still a chiropractor, I still adjust and do, the cracking thing. There's a time and place for it, of course. So it's not like I call me a chiropractor or a therapist or, a sport therapist, a manual therapist, a physical therapist. Like, these terms are all technically, like, in my world now, pretty interchangeable.
Oh, that makes sense.
Yeah.
So who's like your typical, probably no one's typical, but what's your typical type of a patient? Is it the old guy who's got tennis elbow like me, or a guy that plays for the Maple Leafs?
That's a good question. So I still see a lot of corporate workers and just individuals that love to be active. But my niche, I guess, now is I see a lot of basketball players, a lot of soccer players. A lot of lower extremity injuries is kind of what my practice is now, and a lot of athletes. And from age, I think my youngest guy, he's like my favorite little guy to treat because he loves the needles more than some of the older guys like them. He's 9 years old, and he's like phenomenal with the treatment. And again, the more adaptable we call it, your tissue is, the better you respond. So these kids respond phenomenal to the needles, and they're all kind of trying to make it pretty far in soccer for the most part is kind of the group I see. But again, whether I'm seeing, all these guys have a lot of low back pain as well. It's not just like ankle sprains and hamstring injuries and whatnot. So whether I'm seeing somebody who's, 70 years old with back pain, or like, an athlete who's very quad dominant and has really bad back pain, treatments are usually pretty similar.
Okay. Now you mentioned needles. Are you doing acupuncture?
Yeah, I'm sorry. That's what I mean when I say needles. Yeah. Yeah.
Okay.
And that's where I picked up on that, wrote it down too, because I wanted to. I don't know anything about acupuncture.
Okay.
I did have it. I did have it one time. I had a shoulder injury at work, and I was on a workman's comp thing for a few months, and I did get prescribed to go to an acupuncturist, and I didn't know much about it then, but I do remember it kind of being a little uncomfortable, but then it wasn't, because she was really good, and it was no pain involved. And but I only did one, and I don't think that was really prescribed.
Well, if it helped, it helped. So
Well,
I have a
no,
1 or
that's
a
true.
10.
But I do remember it didn't hurt, and it was really cool. But that's my extent of knowledge. What's
Interesting.
the give us the rundown on acupuncture?
Oh, yeah. Okay, so there's a lot of different courses out there, a lot of different ways, I guess, to use the needles. You just said acupuncturist, and automatically, I'm assuming you saw somebody who is traditional Chinese medicine based. I don't know how it works in the States and Canada as a chiro who's, trained to do the neurofunctional acupuncture. I can't call myself an acupuncturist. That term here is strictly for like any individual that's registered with the College of Traditional Chinese Medicine Doctors. So I'm wondering if you saw an acupuncturist, and there's so much overlap between, I guess, the different types of acupuncture. But when we're talking about neurofunctional acupuncture, think about it, like nerves innervate everything in your body. They innervate the skin, they innervate the ligaments, the muscles, the joint capsules, even the arteries, the bone periosteum, like the lining of the bone, which we know now is a pain generator. They innervate everything. So basically, with neurofunctional acupuncture, we can get pretty fancy with treatments, but we're just tracing out the nerve pathway from basically spinal cord down to where the local area where you have pain. So, say for example, your like tennis elbow, your elbow. So you'd have some needles like if you're face down, the back here where those nerves start, and we just kind of trace down, and then we hook it up to very low frequency electricity. And it's a concept called, I don't want to get too technical, it's called neuromodulation, nerve, modulate, normalize. So we're trying to normalize the nerve signal because that nerve signal that's hypersensitized, which is basically like there's too much input going into that pathway, is what's causing the pain in the first place. So if we can just treat along that nerve pathway, you're basically treating it from like top to bottom. And you're also not, you're not kind of playing this guessing game. Is it the muscle? Is it the ligament? Where you treat the nerves, you kind of treat everything.
Is
Yeah.
that kind of like a TINS device, I think they're called, where they get those
Okay.
little electrical impulses on your back?
I thought you were going to say Dr. Ho device because that's how I learned who Dr. Ho was. Is everybody would be like, "Oh, is this like Dr. Ho?" And that's how I learned who Dr. Ho was. But I think he came up with or he has a device. I don't know if he came up with the TENS or what, but yes and no. I say no because the whole idea of the TENS device is you're getting the nerves that innervate the skin. So you're not getting the nerves that are deeper, to innervate the actual muscle itself, because you have to get pretty deep with the needles to get some of these nerves. But you're still calming down again. The nerves on the skin can be hypersensitized. That's the term we use, which will again cause inflammation in the area, which is going to start that pain pathway. So it will calm down those nerves. I have a lot of people that use it. I don't ever go out of my way to recommend it. I don't prescribe it, simply because it's pretty temporary. It's nothing that's going to actually like get. It's a band-aid solution, for lack of a better term, because you're just treating the area
Right.
that's hurt. But I have a lot of people that use it that say it helps them so much, and I would never tell those people not to use it. Right? I always tell individuals, like, no matter what the guidelines say, no matter what any like professional tells you, like, you listen to your body over anyone else.
Yeah, do what works. Have you ever, I don't know if it's still a thing, but probably 15 years ago or more, there was an exhibit that came out of China that was going through the big museums. I think it was called the Body Exhibit, and they
Oh, it's
actually,
so cool.
you
Yeah.
saw it, okay?
Bodyworks.
It's on permanent display at the Excalibur in Vegas.
Is it? Very
Yeah.
cool. But man, when I
Bodyworks.
saw the nervous system, how they dissected a body to keep the nervous system intact, and how that looked, I mean, it's just fascinating.
Yeah, it's crazy, and that's actually real life. It's wild.
Yeah, yeah, it's pretty cool. Everybody should see that.
Yeah,
You
it's
know, I've I have a background in yoga and also a background in nursing, and I really find it interesting how the nervous system works because a lot of times, like when somebody's not flexible, they blame it on the muscle and they're trying to stretch the muscle. So it's funny because somebody can be super tight, ideally or theoretically, muscularly, but then if you put them under anesthesia, where the nervous system is taken out of the equation, you can move them around like Gumby. You can, take their legs and move them. So it's not a muscular thing that's preventing somebody from being more flexible. It's actually a nerve thing that stops the muscle and says, no, we're not stretching any further. You're done here. And that's why in yoga, we really focus on creating that mind body connection and encouraging the nervous system to relax so that you can stretch deeper. But it just fascinates me that, okay, the nervous system is going to stop you here over some fear of injury, but we put you under anesthesia and we can totally stretch you out, put your legs and arms in any position, and you're unharmed unless, like you have an injury or something, but you're
Really,
unharmed when you come back out.
that's pretty wild
It
because
is.
you turned me on to the yoga girl, Boho Beautiful, and that's a
Yeah.
great yoga channel if you're
Hmm.
interested. And I see her, and she, I'm out on my patio, and I'm trying to get to my ankles, and
Hmm.
she's like got her elbows on the floor,
Yeah.
and but you're really saying if I was under,
Anesthesia.
I would
You could fold you up like a rag doll. Yeah.
seriously,
Oh yeah. You put your legs behind your head.
huh? I will. That's
I love
interesting.
that you just said that. Like, and the hamstrings are like the best example of that,
Yeah.
because this is what like people like just like cranking on their hamstrings and just trying to like surpass this pain of trying to stretch out their hamstrings when that's not
Hmm.
actually the underlying reason. We know that now.
Yeah.
But yeah, you're right. Like when you feel pain, it's the muscle, it's a reflex arc being like, oh, stop, you're going too far. Like, and
Hmm.
it's that comes from the nervous system. So that's whenever we're telling individuals to stretch, it's always like the idea of you're not yanking and cranking on your body to like, improve that range of motion and that flexibility. You're just going as far as you can, and then you're relaxing and breathing into it. And as you're naturally breathing into it, you get further.
Yes.
But I
Yeah.
love, I love that you said that. Again, it all
That
goes back to addressing the underlying issue of what's actually going on, because even with the hamstrings, we know they're hyperactive because they're weak. So the
Yeah.
actual in a lot of those individuals,
Or the
yeah.
abs are weak. Or the abs
Oh,
are
for
weak.
sure. Like
Yeah.
the deep core muscles. Even if somebody comes in with like a six pack and you get them to do a few tests and like they can't even, they're so shaky. They've got rib flare sign. Their diaphragm is completely off. It's like that deep core musculature that actually supports the entire rib cage and spine, for
Yeah.
sure.
Yeah. I've noticed and even read stuff about it. Like if your abs are weak and it's causing your spinal column to concave, like your lower back is sinking in, you got this big sway back in the lower back. Well, the pelvis is tilting forward from the top, causing that low back to sway in. And so the hamstrings are going, whoa, 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 and they're pulling that pelvis back. So
For
sometimes
sure.
it's not always that your hamstrings are tight. It's the body saying, whoa, whoa, you're getting all out of whack. You're screwing up
Thousand
the
percent.
central nervous system running through the lumbar
1000%.
spine. And we're tight on purpose just to help save your back from getting any further injury.
1000%. And
And
it's even, you bring up the core. I think of,
mm-hmm,
I guess just the population I see, they're very quad dominant.
mm-hmm,
So the runners and the hockey players, the basketball players, the soccer players, like the quads are a lot stronger than the hamstrings, and we can
yeah,
even isolate and test that out. So yeah, again, similar to what you're describing with the abs, I always describe the pelvis like a pulley system with the quads and hamstrings. The
yeah,
quads are stronger; they're yanking you like this into this anterior tilt, and now the
mm-hmm,
hamstrings just naturally are trying to bring you back to neutral, but they're not strong enough. So you end up with really tight hamstrings. So in those situations, it's like, well, like loosen up your quads actually and strengthen your hamstrings, and that's going to even out over time and save your
mm-hmm.
back.
Yeah, absolutely.
Yeah.
And
Yeah, a lot of
so is
factors
in
to
the
consider
abs.
for sure. It's not so black and white.
Mm-hmm. Yeah, I always think it's
Yeah.
funny because I've known yoga teachers that have actually tore a hamstring because they're trying to get further into a pose instead of doing what you're saying, balance the body out. They're cranking on these hamstrings and tear them. Yeah.
Yeah. Yeah. It's always unfortunate when that
well,
happens. It does
I
happen.
I am not a yoga instructor,
But
and I don't
I
have all
know.
this experience.
you're practicing.
But one thing that you mentioned kind of triggered in my head, and that, like, for example, if I'm bending over and just doing like a half, what do they call it? Just when you're bending over,
It's a forward
like a
fold.
forward fold.
Hmm.
Uh, and then I can get my hands just underneath, halfway down my shins, say, for example. I never realized that when and I will do what you mentioned. I will take the breaths and stay there for 5 or 6 or 10 breaths, and every breath I can get like a half an inch further, half an inch further, quarter inch further, eighth inch further. I don't know how much, but I'm getting further
Hmm.
on literally every breath. I always took that to be okay. I'm just loosening up and things are happening. I never went back to I never even considered it because I don't have the medical background, that's all going into that nervous system. I'm asking this question. Is that because it's just relaxing I'm kind of, my nervous system is just kind of becoming accustomed to that, and that I'm not, how does that allow me to
Yeah, that's a
do
good
that?
question. Yeah, that's a good question. Again, that's part of it. As you're breathing and like relaxing, your heart rate's going down. The nerves are also calming down. With the hamstrings, actually, it's a lot more. There's a lot to consider. It's interesting because if you, for example, we always like kind of, there's a few things that like come into play, and it's usually a process of elimination, for lack of a better term. That's the whole point of like a physical examination, just testing things out. Is we start out with the most likely thing that it could be, and then we retest. It's like we test at the beginning, we treat, and then we retest. And if it doesn't improve, then we go to the second most likely thing. And it's kind of it is a bit like putting pieces of the puzzle together because the body is so interconnected. But the very first thing I do is I take like a golf ball or a lacrosse ball, and I just get people to roll it like their plantar fascia, the bottom of their foot, and then try that forward fold again. And I've noticed that's actually the most significant thing that actually calms down that whole circuit, is rolling out the bottom of the feet, because the plantar fascia is actually a continuation of the posterior chain. Have you guys heard of the concept anatomy trains?
Anatomy trains? No.
By an author, I forget his first name, but Myers. It's pretty big in our field, but it talks about different fascia. So every muscle is surrounded by fascia.
Mm-hmm.
And these, there's different fascial planes. So for example, my left lat, like my left back muscle that attaches here, is actually connected to the right, to the front of the right knee, through the spiral line. So there's different like fascial planes and lines.
Wait, crossing the body from your left to your right?
Yeah, it's actually pretty interesting. Yeah, and we see this a lot, for me anyways, in basketball players when they're like shooting and whatnot, and then they end up with a lot of left knee issues because the fascial plane, if you actually dissect these bodies, it's pretty like fascinating. You actually get the lat that attaches like onto the inside of the arm here, and the lat muscle is massive. It's over the whole back, and then that fascial plane crosses to the other side, like the low back on the opposite side, down the glute, crosses to the front of that hip, and then goes down and attaches onto the tibial tuberosity, like right below the kneecap.
Mm-hmm.
So that's the same fascial plane if you dissect it. It's pretty crazy. So there's 8 that have been like really looked at. There's 12 overall, I believe, that he describes. So yeah, exactly what you're describing, Rick. We always treat and we test along these fascial planes. We find that that's the way to kind of target things top to bottom, and especially with these athletes.
That's very interesting because there's a lot of asymmetric sports, golf, tennis, pickleball, basketball.
Sure.
You're doing repetitive motions over and over on one side of the body. And it's interesting that's going to have a detrimental effect on the left,
On the other side.
on the other side. Yeah.
Yeah, and sometimes in some sports, that actually serves to your advantage. I've learned the hard way with random baseball players and from my mentor, that I've learned everything from. Basically, I've learned that if somebody is limited in external rotation, like a baseball player, you actually don't want to open that up because the shoulder's adapted that way. I know you guys are really into pickleball because you mentioned pickleball to me previously, and with tennis elbow and these elbow problems, like if you were to come in, we wouldn't even look at the elbow first and foremost. We would look at the shoulder and the wrist, because we see the joint in the middle. So the knee and the elbow are like the primary joints that they're stabilizers. So they're not meant to take on force. So if there's a dysfunction at the shoulder that's not absorbing the force, or if biomechanically something's off with the wrist, all the force goes to the elbow, right? The elbow is just like basically the intersection of force between the wrist and the shoulder. So in pickleball players, for example, like when people come in, like, I mean, I don't have any pickleball players, but tennis players, I've seen quite a few tennis players. We just address their shoulder and wrist, and suddenly the elbow just pain's like miraculously gone. But it's not a miracle; it's just biomechanics, right?
Yeah, that is amazing.
As you were saying that, I reached over and I just touched that little bone there that always hurts and still does. And I haven't played pickleball in probably 6-8 weeks. I'm not quite as avid as Jim has. I mean, that just because I haven't, not for any particular injury reason, but and as you're saying that, I'm thinking that, okay, we always talk about health and wellness, and that's kind of the lane we're in, and that we always talk about let's treat the cause, not the symptom. Where the big pharma and everybody, they just want to give you their prescription pad to just cover up the symptom.
Yeah.
So now I'm thinking, I'm relating that to my elbow that still is tender right here at the end. What am I doing? I'm taking a step back. I've been treating the symptom by putting that little strap on or whatever, and putting the lotion on it and doing some of the arm exercises.
Which is still helpful, and still because first you need to address the pain. So ice, amazing. The most underrated, cheapest thing that anyone can do is throw ice on, and not ice packs. This is something that one of the surgeons that I work with taught me is ice packs have a chemical in them that basically make them completely clinically useless. Just real ice cubes in a Ziploc bag, no barrier, and that will never actually give you any of the like those. I've seen like people come with like blister burns, and before I actually learned this, I had no idea why some people would, some wouldn't, some loved ice, some hated it. And then when someone asked me like, oh, like what kind of ice are they using? I'm like, what? I don't know, ice. Like I just thought it was like the weirdest question ever, and it was like, you don't ask people what kind of ice they're using, and I'm like, no, like ice. And yeah, this is a difference, like ice pack versus like real ice cubes. The chemical and anything that's colorful has a chemical in it to make it colorful, right? And that actually makes them completely clinically useless, which is
Why?
so
I don't
wild
understand.
to me. I don't know. When I've looked it up, there's not really anything I can find that's like any research that's significant on it. The surgeon that told me that said it came from a lot of years of experience and just that's what he's figured. But there's not, can't find a single article that really, it's never been researched. It's one of those things I think that ice packs are super convenient, and even I'll use it sometimes if I'm, have something going on. And convenience is important, especially for people that are busy and running around and training and whatnot. It's not the most convenient thing to grab a Ziploc bag with ice cubes that's going to melt and make a mess. But yeah, if you're somebody, like I challenge everyone with back pain to like get away from the heat and put ice on your back. Real ice, not ice packs, and just see where that takes you, because ice is, I think, the most underrated thing. So we would still, to go back to your point, Rick, it's not like that shop is not helping. It is helping. It's still taking pressure off the elbow, but it's not addressing the mechanics of the shoulder and wrist. That's all. But we still use a lot of, like kinesiology tape with knee problems, even though we know it's coming from above or below and whatnot. We kind of adjust it all. But when someone's going into like a game or whatnot, we're still going to add like a brace or add tape and whatnot if something is actually going on where they're having a lot of pain that's going to affect their performance. So not that that's wrong. There is a lot of value to that as well. But big picture, got to adjust above and below.
So if I came to you and you were going to work on my elbow and you had me lay down and you start acupuncturing me, what actually, when you make the puncture, what is it actually doing inside the nerve or on the side? Does it go in the nerve itself, or how does that work?
Yeah, it depends what we're trying to accomplish and what we're trying to do. We're never like stabbing right through a nerve, and that's not the goal. If you had, and this is the answer to a lot of these questions, is it depends. It's tough because there are so many little things that we consider. But if you come in and you just did something to your elbow like yesterday and you're in like 10 out of 10 pain, for example, we're not putting needles directly into the elbow because that's just going to blow it up. We're going to just target the nerves above and below that area. And I would probably throw ice on the part that's hurting you. And then I would target above and below with the needles. And what the needles are doing is they basically signal the body to, it's like a vascular response. You put something in and suddenly it signals blood flow to that area, and it also releases what we call these natural like opioids in the body. Okay, when we hook it up to electricity, that's where we get into this whole idea of neuromodulation, where we're just normalizing the nerve signal. And that's the cool thing about electricity. That's why I love it so much. Is if an area is weak, we basically add electricity, and you're waking up the nerve. However, if an area is overactive, you add electricity to calms down the area because it's normalizing the nerve signal, and it can normalize it both ways, which is the coolest part of it, in my opinion. It's my favorite part about it.
So it's kind of like a mini shock with the heart. What's that thing called?
Yeah, if it were weak, for example, but in your situation with an elbow, if we're going above and below and just tracing that nerve out to the area that's hurting you, where basically the number one thing is blood flow. It has a huge blood flow response because we know, again, if you have elbow pain, there's a signal from your elbow to the spine cord, to the brain, back to the spinal cord, back to the elbow. Okay, it's a big loop. A lot of stuff happens along that pathway. It gets pretty complex, but it happens that loop is like a millisecond. This pain pathway is like very, very quick. So basically we're trying to, what signals this pathway, first of all, to even be initiated is inflammation of the nerve sheath, which causes a bunch of inflammatory markers to the area. We call it neurogenic inflammation, which is a fancy way to say basically just enzymes and inflammatory markers in the area, like so in his elbow, for example, Rick, that's going to actually signal this pathway. So the number one thing that adding these needles is doing with electricity is that blood flow effect is going to clear out some of these enzymes and some of these inflammatory markers. Right? So the more of this that you can do, the less signals you're going to have going into that pathway. Does that make sense?
Yeah, that's
Mhm.
pretty
Am I explaining
interesting.
that? I'm trying to be as simple
Yeah.
as possible, but I'm not. I don't really explain it to this extent in clinic. And I've worked with the same people for so long, and usually, like, whenever I try to explain anything, they're like, yeah, whatever, just do your thing. Like, they don't. So, I hope this makes sense.
It's really
Mhm.
interesting.
Yeah. When you have somebody with upper body extremity pain or different things, do you also like look at neck alignment? And the reason I ask that is, being a yoga teacher, I had this one woman I used to work with that decided to take a teacher training program in Hawaii because it was all fancy, and she's like, wanted to do that instead of my teacher training program. So she goes there and they make her stand on her head 5 minutes a day, twice a day, because that's the optimal pose for the most benefits. And she comes back and she's got bilateral shoulder pain. And I'm like, what were you doing there in Hawaii? And she told me. So she goes and sees her doctor, and she's literally has two compressed discs in her neck bulging out and pushing on her nerves, causing bilateral shoulder pain. Um, and your brother's wife, Lita, um, she all of a sudden had trouble speaking, and she's going to the doctors and she's going to the hospital, and they're running all these tests. And I'm telling them, Mike, have her go see a chiropractor, have them check out her neck, make sure her neck's fine. And after running through every other type of doctors, they finally go to a chiropractor, they adjust her neck, and she can talk fine. you know
Yeah, I have no. That's interesting. I have no explanation for that. I can't say if someone tells me that they know someone who's having a hard time speaking out of nowhere and it's acute. I would tell them to go to ER. Like, I'd be lying if I said that. Yeah, that's crazy. That sounds phenomenal. I don't. I've never seen that, to be completely honest with you. The neck is one area that I'm very conservative with adjusting for, and that's a whole other conversation that will lead us down a dark hole. So that's interesting. And I mean, I will tell you, like, just to answer your first question, if someone comes in with bilateral shoulder pain, again, the first thing we do, and this is the whole point of like a functional assessment, is we look at their neck range of motion. I hate the word alignment, and this is where the spectrum and the terms that we use, this is where there's some differences in amongst chiro to chiro. And I'm not saying one's wrong, one's right, one's better than the other at all. I'm just saying that when you're looking at things from a functional standpoint, we would look at, for example, like arm abduction, and like it's passive, right? So you're taking the muscles out of the equation, looking at the joint capsule, and then say it's really restricted on one side, both sides, whichever. We would look at actually the neck range of motion, and then we actually wouldn't even touch the shoulder. We would treat along like the nerve pathways here, just soft tissue. We're very gentle, just trying to clear out any like edema, which is just inflammation that could be in that area. And then we'll retest this passively, and then we'll see if that improves. If that doesn't improve, then we know we to go to the shoulder. If that improves, we know that the neck is the issue. And most often, like more often than not, it's actually the neck. And people are always like, whoa. And it's like their necks are like great. Like they have so much stiffness in their necks. They have a history of, I don't know, being a hockey player, being slammed into boards, getting into car accidents. Like there's just, and unfortunately, again, yeah, because the nerves that innervate the shoulder come from the neck. It's like the same thing with the hip. The nerves that innervate the hip come from the back and the sacrum.
Yeah.
So yeah, no, exactly. And again, this is where I'm talking about like putting pieces of the puzzle together. And like a lot of these answers, they're not black and white because it's a huge gray area. The body's so cool in this way that, I mean, it makes our job harder, but
Right.
for sure. But yeah, it's not so black and white. There's so
Yeah.
many things. Bless you. There's so many things to consider.
Yeah. Violin players, I mean, they play violin like this,
I
chronic
know.
neck
I've never
problems over
seen one, and I
time.
can't even imagine even like everything. Oh my gosh, even doing that right now, I'm like, oh my neck. For
Yeah.
sure. Yeah, that's interesting.
I never thought about a musical violin injury, but
Mhm.
yeah, that would kind of. But I suppose just like anything else, when you started out, you're 5 minutes a day, and it just kind of works its own.
Yeah,
You get
no, I would
accustomed
actually
to
be
it.
curious to see a violin player. Like, yeah, I'd be so curious because we see certain trends in soccer players. Like, for example, their hip external rotation, their dominant leg, we know is going to be limited. Like, you can just by looking at their hip motion when they're laying on their backs and they're relaxed, and you just play with their hip. Like, you just know which leg they kick with. Hockey players, we know internal rotation is going to be completely like tight and restricted. We know what side we can even predict what side to shoot on depending on the pattern of left to right hip. But with violin players, that's so interesting. Like, I've never seen one, but I would be curious. I'm sure there's some pretty cool pattern that exists with them. Unfortunately, I just haven't seen any musicians that, you know, crank their necks like
Even
this.
even chiropractors. Chiropractors tend to do all of their adjustments asymmetrically. So they're constantly cranking all or tightening all those muscles of the spine. I had a doctor come into my yoga studio. She was a chiropractor, and she was telling me she had some scoliosis. And I'm like, you know, that's totally correctable, right? She's like, oh, no, you can't fix scoliosis. I'm like, well, let's think about this. Her name was Ellen. She ended up taking my yoga teacher training and becoming a great yoga teacher. I said, what's holding all those vertebrae in alignment? You don't like that word alignment. What's holding all those vertebrae in
No,
the
no,
right
use alignment. I know what
relationship?
you mean.
We'll use right
Use
relationship. I
alignment.
like that better. And she said, the soft tissue. I said, okay, well, what controls the soft tissue? Your mind, right? So your mind controls all the muscles. So if you retrain your muscles, you can fix scoliosis. And I've done it. I fixed her scoliosis because what I said is I said, okay, we're going to stretch out the tight side of the body. We're going to strengthen the loose side of the body. And every time you do an adjustment in your office where you're cranking down on somebody like this, when they leave the office, do the exact same motion as many times as you did on the left side to the right side. And it's like within 5 months, she had totally corrected her scoliosis.
Interesting. Yeah, I haven't talked about aloud about scoliosis in a while. I used to see a lot of scoliotic patients, actually pre and post surgery. Scoliosis, again, one of those things. It's, I think, a bit more complex than the information that's out there. There's functional and non-functional, or structural and non-structural scoliosis. So when we think of scoliosis, we think of just like a deviation in the spine, but that's not true scoliosis. Scoliosis like that, which is what I imagine this individual had, can be corrected, and that's usually a muscular imbalance. But true scoliosis, pardon me, is actually rotation of the vertebrae. So you get rotation of the vertebrae first, so they physically rotate, and then that rotation is what causes that deviation, right? That scoliosis, depending on the curve, is almost always, if again, there's a certain, I think it's 60 degrees or higher, like it's, especially in females that are growing and whatnot, if you actually get that rotation and the curve is a certain degree, that has to be surgical, and surgery is phenomenal for that, right? But when we're talking about if later in life, if we start to get a little bit of a curve, that it's still considered scoliosis, but we would consider that more functional scoliosis, that can be corrected with a lot of exercises, right? But there's quite a few different causes that that are responsible for the one that actually causes that rotation that you need to monitor pretty closely with, especially in adolescents, versus just the scoliosis that causes just imbalances left to right with that curvature. Because I guarantee, like, there's a stat on it. I don't even want to throw a number out there because I don't remember what the number is, but almost every single person has some degree of deviation. But it's not rotation and deviation, and that combination is what causes scoliosis that is more significant. Does that make sense?
Yeah,
Yeah,
it
for
does.
sure.
So I would say that like probably 95% of chiropractors have a functional scoliosis because I've gone to a chiropractic convention before and I look at all of them and I look at their spines
They're
and
all curved.
they're all curved to one side where they've been doing their adjustments the
Really?
same way. Oh yeah. Yeah.
Although you
Interesting.
look pretty straight, you're pretty vertical.
No, I mean, just see my head and my neck. No, and I do
I'm looking
actually
at
have
shoulder
some,
height.
I do
That's
actually have
funny.
some degree of scoliosis, which again, I think it's the terminology we even use amongst, like, it depends on the age of the individual, but you know, especially when there's certain age groups where I wouldn't even use that term because I don't want to put, you know, these negative,
Like a
because it
label.
can be like, especially when you're a young growing like female, even a male, and you know, and you're like noticing something's off about you, and I like notice like a curve slightly and whatnot. Like, scoliosis is a term I wouldn't just throw at them and at their parents because it's so common, and again, just self-esteem is, I just try to make every experience, I think, with everyone I work with, positive, because then this leads to another aspect of, I guess, of care is just trying to create some type of positive experience for the person. Like, I used to work a lot in chronic pain when I first graduated. The clinic I worked at was a lot of chronic pain, and it was actually a pleasant surprise. Like, the way they kind of teach this population and in school is individuals that like never get better, and like I will never use the word chronic in clinic because that's just already like you're already like doomed. Like if I got told chronic,
Yeah.
it's like I'm gonna have this for the rest of my life. Like, so I actually never use that word. I'll just say persistent or something different. And a lot of these individuals, I realized like it's a big component of it is again this pain pathway. It's so complex, and a big component of it is like you don't even know if you have pain until that signal reaches the brain. So a lot of it can be mental, and I think a lot of like experiences in life, and also just the professionals you're working with and like what they're communicating is just feeding into that.
Mm-hmm.
So for me, like for example, like there was this one lady, and of course I'm not gonna say her name, but she just sticks out to me, and like she'd get a haircut, and I would be like, and she'd come in like just miserable, and I would just be like, I don't know, just trying to be more myself, and just be like, oh, I love your haircut. Oh, like where are your pants from? And I would just try to like a compliment a day truly like in this subgroup goes so far. And like yeah, like by the after like I don't guess 2 weeks, like it was like night and day, and she's been I don't know, like told she said like she was gonna be suffering with this pain for her whole she's had been suffering over 20 plus years.
Mm-hmm.
So I'm like pretty careful with the term, like telling young kids, "Oh, I think you have scoliosis," when their parents are in the room and worrying everyone, or just being like, "Oh yeah, so this is chronic. It's gonna take time." Like, I won't even say that. I'm just gonna say like it's group team effort. Like I'm like you, what we gain in here. I need you to like do this to maintain it, and we're gonna get somewhere. Like
Yeah, I love the way you're choosing your words and giving it a more positive approach. That's awesome
took a
because
while for me
label.
to learn how important that is. But definitely took like 2 years of practice for me. My first 2 years.
Yeah.
Yeah, definitely took a while to learn. I guess everything's learning, right? Just
Mm-hmm.
experience. Like, you try
We
one
t-
thing,
we
doesn't work, something else.
we talk a lot about and bash the medical community because of the reliance on big pharma and drugs, and your doctor, at least down here, especially if you go to a corporate doc, that's part of a big chain, which most of them are now, that they immediately just want to write you a script. And it seems like what you're talking, that you didn't buy into that whole way of thinking, and said, and that chronic patient doesn't have to really be chronic. I'm a believer now, after the things that I've learned in the last few years of me getting out of that, mouse wheel that you're constantly on, that most of these things that are chronic or can be fixed with diet, exercise, and maybe alternative medicines that, like acupuncture and other things, although I don't have a lot of experience with the acupuncture, but I would never discount it. Once you get out of that moray of big pharma and big medicine, and especially since COVID, the confidence in the medical community has just been destroyed. And more people I know, have to be reaching out to you and waking up to this big pharma runaround that most docs just want to get in. So if you can find a doctor or someone like you who will look outside the box, and let's go back to the root cause: nutrition, exercise, blood flow into certain areas. It's kind of a rare find, but it's becoming more prevalent.
Yeah, yeah, that's an interesting point. And um, one of the clinics I work at, again, there's physicians, there's sport medicine doctors, orthopedic surgeons. So I have all the respect of the world for the medical system. I do. I think there's a time and place for everything. Um, but I will say, like, no matter what field we're talking about, you just have to find the right people. And it's actually been pretty inspiring to me to see how open-minded a lot of doctors are and how much they are willing to actually work with you. And I think that's going to be the big shift. And I hope it is, like when I'm like years and years and years down the road when I'm not even around. Like I truly hope that things are more like people are working more collaboratively, and because every clinic here, and I guess I'm in Toronto, calls themselves an interdisciplinary clinic, which means we work we work together. But it's like it's not like that. It's like every discipline has their own people they see, and that's not collaborative care. Whereas, working with the doctors and whatnot, it's truly like there's a time and place for everyone, and we do have athletes and patients that are mutually shared. And for example, I'm going to throw like low back pain, for example. I'm going to throw that out there. And if you have a disc herniation, the last thing you want to do is lay down and not do anything all day. But if your pain is so bad that that's what you're doing, I tell everyone I treat, I'm like, you need to take Advil to keep moving. You do, or else your back is going to stiffen up, and this is going to be a really challenging thing for both of us to help you with. So I always tell people, like, there's a time and place for everything. Like, there's a time and place for surgery. I'm not against surgery. If you're a professional athlete and you blow an ACL, like your career is done unless you get surgery. Like you need a surgery. Like there's a time and place for everything. I think it's more so people that I don't want to say are lazy. I hate the word lazy, but I don't know what other word to use. But yeah,
less motivated.
Well, I'm much more cynical than you in the medical establishment.
I'm trying to be careful.
I'll just lay that out there for you. Because especially,
I don't know what we're doing with this podcast, so I'm trying to be careful.
No, that's okay. I don't mind this. We're still friends, but because this is what you mentioned lower back pain right when we started. I made a note, and I'm glad we came back around to this with what you just said, because it seems like anybody that I know, and I'm 60. Jim and I are cousins, by the way, so we grew up together. But anybody our age group, it seems like that. Oh, I have to go have back surgery, and I say, why? What's up? Oh, it's this or that or this or that. And I notice, they got 40 pounds of beer gut.
Yeah, don't get my blood boiling with back surgery. That's another conversation. Don't even start with.
And I'm like, and it's a friend of mine. I'm like, Larry, I mean, think about this. If you lost 50 pounds, you're sitting at 280. You really should be 190. But even if you lost half of that, how much less stress? I mean, doesn't this just make sense? I don't know anything about, medicine or the stuff, but I do know common sense. And if you're carrying around an extra 80, 100 pounds, your lower back, if they cut and fix your lower back, it's just gonna come back. It's once again chasing the symptom, not the cause.
Right.
And once again, and stuff like that but he never got that advice from his doc.
And it's the recovery. I don't think these patients realize the recovery that comes with a back surgery. And actually, a lot of them don't have any symptom relief afterwards. There's a lot of research on this, but the only group that actually responds well to surgery is what's called, have you guys heard of claudication? Basically narrowing the spinal canal, and you actually have a lot of leg symptoms and cramping and whatnot. So if your leg pain, if you're a certain age group and you have certain image findings and your leg pain clinically is worse than your back pain, that's the only group that actually down the road, 1 year, 5 years, 10 years down the road, actually responds well to surgery. That's a very small percentage of people that come in with back pain. A very, very small. Like when I say very small, I mean like 1% less. Right. And I've seen, unfortunately, like a hockey guy. Well, he grew up playing hockey, played professionally for a bit. He doesn't play anymore. Got a back surgery, and like his career's over because of the issues with his back. And like we work on his hips, and suddenly his back is so much better. Again, this is where we get back into like the whole connection of the fascial system and whatnot. But yeah, back surgery is an area that makes my blood boil. And like it's the one time if someone comes in with a disc herniation and they're talking to me about surgery, that's the one thing that I actually will like be like, whoa. And I, like, even if I'm seeing it for the first time, I'm like, this is insanity. Like, you are going to ruin your life. Like, and I will say that blatantly. Like, like that is the one thing that I am very confident in saying. And I always say, if you are consulting with, like, if you're considering surgery, get as many opinions as possible. Get more than just my opinion. Get more than just one doctor's opinion. More than just one surgeon's opinion. Get opinions. Like, the biggest red flag is somebody who's telling you what's right and wrong. Like, the way that things need to be communicated is like, okay, like this is your situation. Like, what are your goals with the surgery? Or what are your goals, like, from not getting a surgery? And then they tell me their goals. And I'm like, well, based on what you're saying, like, research tells us, and from my experience, like, if you were to get the surgery, which helps, like, most of these cases, like, these are the pros, these are the cons to getting it. These are the pros and cons to not getting it. But I always tell people, like, you should feel like you're making the decision at the end of the day. Get as many consults, but at the end of the day, like, you need to feel like you've consulted with enough professionals to be informed to make your own decision. And the biggest red flag ever is when people come in and they're just like, this, like, I was told I need a surgery, and I'm like, by who? Like, oh, my family doctor, and then they also like referred me to a surgeon who also said I needed the surgery, and I'm like, that's already, like, I don't even care what's going on with you. Like, that is a red flag. Like, even if you need a surgery, like, that is not a surgeon I would go to. Like, you need to go to a surgeon that understands, like, your goals and what you're looking to get out of it. Because a lot of the times people want pain relief out of it. And that is not going to be the way to get pain relief. If that makes sense.
Doctors have big bills that they got to pay. And if they don't have people coming in for surgery all the time, they're not going to be able to pay those bills.
Jim shares my
Well, that's what I say as well. So one of the surgeons I work with, I used to, like, if I'm not seeing somebody, like we'll just like he'll let me come in and like observe and stuff. And I did quite a bit of observing a few years ago, and he will say, I remember this one time where he was just like, wait, sorry, what's like this person was coming in for this is the second consult with the surgeon, and he was like, how old was like who was the surgeon you saw? And the surgeon that was there like didn't know him. So he was like, how old is he? He was like, oh, I don't know, he looked pretty young. And then the surgeon was just like, that okay, you've said enough already, like not because being young is bad, but because as a surgeon, like you being young, like you need to get surgeries in. Like so they're doing a lot of surgeries that aren't going to be helpful in 3 years for this person, if that makes sense. So it's interesting
yeah,
you
it
said
makes
that.
sense.
It's interesting that surgeon actually is the one who even brought that to my attention. I always wonder if people had to pay out of pocket for a surgery. I always wonder what percentage of people will get surgery.
A
Like
lot lower
hip and knee
percentage for sure.
replacements, back surgery, like stuff like that. Like I always wonder, like, yeah, I feel like the world would shift. It's like, and I don't want to get political, and I don't even have an opinion on this type of stuff, to be completely honest. But I always wonder, like, if it's lifestyle changes that's making you consider surgery because you're too lazy to make a change, I always wonder what percentage of people would actually get a surgery or want a surgery if they paid out of pocket, because it would be probably very low or non-existent.
Mm-hmm.
Because
Yeah, since we're
yeah,
talking so much about surgeries, I want to mention something. In a mountain biking accident, I went headfirst over my handlebars, and right before I hit the ground, I moved my head like this. I landed on my shoulder, and I thought it broke my clavicle, my collarbone. And I had my wife pick me up from the woods and bring me home, and I'm sitting on the edge of the bathtub, and I'm in so much pain, and I'm feeling my clavicle for the break, and I'm like, wait a minute, my clavicle's not break. I can feel it's all intact. Like something's wrong. So I go and get an x-ray, and they said, yeah, nothing's broke. The next day they sent me to a specialist. I go see the specialist, and he mentioned a specific type of athletic condition that happens where I literally tore 3 ligaments in my shoulder. Um,
oh, you dislocated your shoulder probably.
it was not dislocated. I don't know. I can't remember the
Did
name
it
of.
like pop in and out?
No, it wouldn't pop in and out. It's just a complete tear of 3 ligaments in the shoulder, one that attaches to the scapula. I forget where the other ones attach. And the doctor was like, you know what? He goes, this is a very common sports injury for people, like mountain bikers and people that land on their shoulder like that. He said, honestly, the surgery is worse than not doing anything. He goes, if you do your own, physical therapy, if you work with that shoulder, you'll completely get range of motion, you'll get full strength, and surgery, you'll just end up with all kinds of problems. And I'm so grateful that for that guy for saying that. And I found that throwing apples in my backyard I would throw them over the fence for the deer. It was like the best therapy I could do. And within 6 months, I was back to playing pickleball with my right hand. And I have full range of motion in that shoulder, no pain. Sometimes when I'm lifting weights, I feel a little bit of pain, and I got to take it easy with weight and just do more reps. But uh, I was hoping you would know the name of that condition. But
I don't know if it's condition, if it's, I'm not, what could have happened is like, because to actually dislocate or to tear a ligament in any joint, you have to have shifting of the bones. So what I'm thinking that happened is you probably dislocate like slightly like your shoulder, like this is your shoulder joint, like the socket.
mm-hmm.
Sorry, I don't know how this is like translating, but you got some shift, and then that's probably what happened is you probably dislocated your shoulder slightly or subluxated, which is a partial dislocation, and it just like went back in. Because you have to have some motion of the joints to actually cause stress to the ligaments enough to tear them. And even when you're talking about this motion, like I imagine your AC joint, a acromioclavicular joint. I don't think you broke it, but I don't think you broke your clavicle. I think you probably tore your AC joint, which is the connection between here and the clavicle.
Yeah.
And when you're talking about this motion here, bench pressing, the AC joint hates that. So I wouldn't even do that if you told me that you, like based on this history and you were in clinic with me, I would tell you to.
For me, it's more like this motion that.
Yeah, because you're same thing.
Pain.
This and this, you're compressing. Same thing. You're compressing that little joint.
Yeah, but you gotta
So
do
you
something
do a
to
lot of
keep the
rowing,
muscles
like
strong.
pulling base stuff is going to be your best friend because it's going to open up a space.
Okay, I'll definitely do more of that.
So I think what you probably did is you probably tore your AC joint.
Yeah.
You probably have what's called a step defect. Like, do you have a bump here? A little bump?
Nope, no bump at all.
You sure?
Yeah.
I'm sure. Like trying to look right now.
I would know.
No, it's something that like.
Do I look?
It's not visible to the like.
Okay.
I mean, if I didn't know if I didn't do what I did, I don't think I would ever notice it in myself because I pointed out to people and I'm like, have you ever hurt the shoulder? And it's called like step defect, where it's very subtle, but I wonder if you have that. But anyways,
Yeah.
it's,
The other thing
yeah.
I want to ask about is healthcare in Canada. Like here, if you go to see acupuncture or something like that, your insurance not covering it. Everything's going to be, if it's not conventional medicine, I'll pay out of pocket. What's it like in Canada where you guys have paid healthcare?
Yeah, so it's not covered by health, like the public
Okay.
healthcare system. It's a lot of individuals here have extended health benefits, so insurance. Anything that I do with the needles, like everything's always billed through chiropractic, and most people have coverage for that. I see again a lot of athletes that either their club, their organization, they have some like dollar amount for treatment, or they pay out of pocket.
Okay.
Yeah. So there's a lot of like the whole idea of like cash-based practices where people like will submit on their own and they just pay cash and whatnot. Like I do submit for people now, like to their insurance providers if they have it. There's two really good systems here and it makes it very simple. But there are a lot of people that don't have coverage through, like they're at an age where they're just trying to make it to like the next level of sport and they're trying to make it pro, and they're not students anymore, so they're not under moms and dads like coverage.
Yeah.
They don't have like their own full-time job that gives them coverage. So they do pay out of pocket, and it can be an investment for sure. Yeah, I kind of see it on both ends.
Okay.
Yeah.
And I want to thank you for being on our show, because I know there's a lot of tension between America and Canada right now.
I don't know what's going. Yeah, I know. I don't know.
I think the prime minister up there said, continue to boo the national anthem. Don't engage with Americans. I think you might know more about it than I do. He tends to be
I think
very up in
that
politics. So.
just that's a function of Ottawa and not the regular Canadian population.
Yeah,
I even think that I'm very conspiracy theory oriented, and
You
even
are.
even in the
We both are.
USA Canada game in the Four Nations, we're big high. We grew up in Detroit, so
Yeah.
Detroit Red Wings, and we played hockey up
Yeah.
in
Mississauga.
Mississauga near you.
Oh,
And
nice. Okay.
Yeah.
so I think that those three fights in 9 seconds of that first Canadian Canada US game, I think it was just all a big psyop.
Oh,
It was
yeah?
at the guy. It was in Maple in Toronto or Montreal. Where was it?
I don't
Montreal, I
remember.
think.
Yeah.
And but I don't think the average Canadian and the average American have any dislike for each other.
Nah,
Governments
we're
are
friends.
governments are governments, and they're gonna, and especially with what we got on our side now, which is very polarizing. And I've never been a fan of your dictator slash premier.
I was gonna. Well, I will say that I didn't even consider, the feud with Canada and America as like a determining factor to be on here. So
Well, that's good.
I avoid the news at all costs. I think ignorance is there's such thing as too much exposure. So I have seen a lot of stuff lately, like just on TikTok and whatnot. But yeah, I'm definitely somebody who avoids the news a little bit because tends
That's
to.
healthy.
It's much healthier.
Yeah.
I'm also just very sensitive to things like that, like where I'm just like I just avoid anything that's going to like give me some negative emotional shift, because I feel like things just like affect me like more than they should, to be completely honest with you. So I just avoid the news. Don't even have a TV in my place.
Excellent. My wife
I don't
and
even know
went
what news channel
for
I go
years
to.
without a TV. Yeah, but now
Yeah,
we
I've
got
never
one just
had
to
one.
watch Netflix and stuff because we got tired of looking at the little screen
For
on our
sure.
computer. Yeah.
Like going to bed, I'll just like throw something on my computer if I feel like watching a show. But even that, yeah. So don't worry, the Canada-America feud is. I don't want to see.
It's for them, not us.
Well,
Right?
TV and TV news is a lot like processed foods.
Yeah.
If you get them out of your life, you're going to be much healthier.
Even scrolling,
there
they're
you go.
doing studies now on things like TikTok, Facebook scrolling,
Oh
I'm
God,
addicted
yeah.
to-
scrolling.
I'm addicted to X.
Yeah, like they're saying that it really has a huge negative effect that you don't realize
For
on
sure.
on your whole system. Yeah, just
I feel
all
like
that
I
scrolling.
wouldn't even have made it like where I made it if I grew up in this generation. This is a hard generation to grow up in. I think like I remember like I didn't even get a cell phone until beginning of grade 12.
How old are you?
I'm 31, but grade 12.
Okay.
How old are you in grade 12? Like high school, last year of high school,
17,
16, 17?
Yeah.
I think that's when I got my first cell phone. Like I just remember every day after school, like we actually had like a knock that like the kids in the neighborhood would like go door to door, like because parents were at work, and we wanted to play like street hockey or soccer, and we had a knock. Like it was, I still remember it. I don't even want to. It haunts me. But that's how you knew it was like somebody that wanted to like like we were like getting together to play something, and my parents
Yeah.
used to have to come out at like, I don't know, like it was pitch black to like bring us in from the soccer field.
Yeah.
Like that was like my whole childhood. I actually feel bad for this generation. This would be a hard generation to grow up in.
Yeah. We were a lot older when we got our first cell phones.
Yeah.
Well, they probably didn't even have a cell phone, but I'm just kidding.
No,
They probably
they
give
did
you
not.
the cell phone.
No.
To give you an idea, my daughter and you are the exact same age. So
Yeah. I think we
Well,
were
my
in
mom
our,
and dad got one when my parents got a phone when I got a phone.
yeah.
Actually.
Okay. Yeah. We were probably what, in our 20s,
I was
maybe
already here. I was
30?
in Florida when I got my search, and I moved here in '97. So
How old were you?
mid 30s, late 30s.
Yeah. So yeah.
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 The
Imagine
world
that,
has
being in our
changed.
30s and getting our first cell phone.
That sounds amazing. Honestly, my
Kinda.
phone's not do not disturb for like the entire day. I cannot.
Yeah.
I've had my notifications off for any social media since like day one university because I know I cannot concentrate if my phone is ringing. Like, you know what I mean? It's just,
Mhm.
it's not that you don't have discipline. It's just if something's digging in your ear like all day,
Yeah. It's a
of course
strange
you're not
addiction,
gonna.
our phones are.
Yeah, and blessing and curse is like the internet and technology right now, right? Like so much information you can access, but also so much garbage you can access too,
Yeah.
for sure. Because
And
there are
once
a
you
lot of
get
pro students and whatnot.
once you get in the algorithm,
Yep.
Yep.
and then it
Oh,
just
I was hoping.
feeds your
Yeah.
echo chamber and will take you down any road that you really want to go.
That's why you have to be intentional with the use of it, because then your algorithm is positive, I think.
Right. Right. Yeah, exactly. What you were about to say, I hope, or
No, I
hope.
wish that we had gone more into the spiritual stuff because I'm so curious about the spiritual stuff that you talked about before. And also would be curious to like to hear Rick's like a whole idea on spirituality and like integrating that into work, but I don't know how much time we have. That's what I was
Wow,
hoping to get into.
You're welcome to come back. I love
Yeah.
spiritual talk.
I'm enjoying them more and more because my education in that is expanding basically daily, and
And it's funny, we're becoming more aligned politically and less aligned spiritually somehow. It's like, what's happening?
well, I don't
I
think it's so
know.
much that it's that I take it as do we want to get into this? I have to.
We don't have time.
I
We don't
have to be
time.
somewhere at 2:00, so I got about 10 more minutes
Okay.
at the most.
But yeah,
But
maybe another podcast so we can just merge the
Yeah.
two or something.
But since you brought it up, just real quick, what is your spiritual background?
Yeah, I'm not. It's so interesting because I mean, this is again, I don't want to get too into it, but my mom
Yeah.
and dad, they're both Albanian, so they grew up in a time of like like just. I don't know much about the history of it, but it was like really a lot of dictatorship with what you could practice or not. My dad's family was Orthodox Catholic. My mom's side was Muslim.
Okay.
Somehow my mom and dad ended up getting married, and
That's a cool mix.
I think I'm like, and it's wild now because I do have a friend, and people are still not able to even consider like anything romantically, I guess, if like you come from a really strong like religious background, and religion and spirituality are to me are two totally different things. Like
Absolutely.
I think this way my parents like raised me is it was okay to go to a mosque, it was okay to go to a Buddhist temple, it was okay to go to a church. Like I went to all of it and it was all cool and it was all positive. Like looking back, like I was pretty young,
Yeah.
but it was all positive. My mom and dad just always kind of preached like there's one God for everyone. Like and then now like that I would not call myself religious at all anymore. I mean, I went to Catholic high school. No, not high school, pardon me. I went to Catholic junior high and elementary school.
Okay.
And I was like, I thought I was religious then, and we always went to church and stuff. And when I got to high school, I didn't go to a religious high school. Now I would just say I'm like pretty spiritual. Like I believe that we all come from the same place. I feel like humans, like at our core, we thrive off of love and connection.
Yeah.
And
what do you mean you believe we all come from the same place?
Like I believe, like what you want to call it, like Muhammad, God, Buddha,
a creator,
source,
a higher power.
Yeah.
A higher power. Like we all come from the same place.
Universe.
Like there's, yeah.
Jody.
I mean, the source is what is, I guess, the broad term of that, like just a higher power.
Yeah.
So now, and yeah, maybe cut this part of the podcast if it is controversial. Like I don't like being controversial.
No, keep it going.
Everyone is so sensitive in the world. Like I'm scared to say anything.
Let's table this for another time.
And this is
I would love to do that.
But I don't believe in religion. I think religion separates the world, is what I'm trying to say. I think religion is just,
Yeah.
it separates the world, and it's unfortunate. There's a war over it, and I'm not trying to dismiss religions at all. I just wish if religion, because technically speaking, like we're all describing the same thing, like we're all describing a God, and we're all trying to like back up our religion with you know, the scripture and the Bible and the Quran and all the stuff, but the stories, the messages are the same. Be kind to people, love people. That it just, I just think religion separates the world. Truly, I think it just causes big separations.
More people have been killed because of religion than any other thing.
Oh, for sure.
Yeah. So much for joining us. We really appreciate your time and appreciate you being on.
Yeah, it was a lot of fun.
And we'll get you scheduled right away. I'd love to have you back. And
yeah, thank you so much. This is so much fun. I really appreciate you guys having me on here. It's been fun. Thank you.
Awesome.
Yeah.
We'll chat soon, okay?
So if you just listen to this podcast and you appreciate the content and the work that we're doing, we would love your support. Look in the comment section of this episode. Subscribe, rate us, comment. This gets our podcast in front of other listeners. And if you noticed, we don't have advertisers. For the cost of a cup of coffee, you can help keep it this way. Become a supporter right now. We'd appreciate it. I'm Jim the Yogi.
I'm Rick the BeachMan.